And thank you for joining us. With us is Dr. Nemunaitis, Sports Medicine, Orthopedic Associates of Meadville, here at Meadville Medical Center. Doc, good to see you. Thanks for joining us.
Hey, thanks for having me.
Well, before we get into your specialty and what you guys do, let's talk about yourself. Let's go way back. When did you start to take an interest in medicine and know that that's the direction you wanted to go?
I guess growing up, I had some family in medicine, so I was introduced at a young age. My dad would take me into the hospital and take me around to see some patients. And in high school, I volunteered at the hospital in different areas of rehab and did some research as I got to the end of high school and into college, clinical research with patients. Growing up, I was always involved in sports, so there was always bumps and bruises to rehab back from. So I was always, appreciated that the people that are helping you recover and get back to being active again, because the last thing you want to do is be down and you're watching all your buddies out there and you're kind of just sitting there, icing up. So over time that kind of developed and I got more and more interest and decided to take the leap.
Where'd you grow up?
I grew up in Broadview Heights, later after 8th grade, before then over here in the Toledo area.
What sports did you play?
Football and wrestling in high school and then wrestling in college.
There's no injuries in those sports.
Yeah, right. Yeah.
It's funny, when you talk to a lot of people, that's football or wrestling, a lot of times those sports will lead into kind of this field. It's kind of fascinating, but a chance to help the youth in their sports get back to play. We're going to we'll talk a little bit about that, but we're also going to talk about later in life and the need for sports medicine, because it's not just for students and athletes or student athletes. It's a range of things, and we'll get into that. But talk about your path to coming to Meadville.
So when I was actually in residency training up in Erie, we used to rotate down here. So that was kind of part of it. I got some early exposure, worked with Dr. Carl. So I got a feel of the things. I enjoyed the community hospital feel. The staff are more friendly. I think people are committed to really helping out their community in the hospital, and I really like that drawing. It's an independent hospital, so I feel it's a lot easier to communicate with administration to get things done. But also I grew up with a hunting camp about an hour east of here near Pittsfield, so we're always out this way too.
And there's such a rich history with this department as well, so that has to be something that you can look at.
Especially the reputation that they had set over the years here is phenomenal. We've got a huge patient catchment area draw that people come here because of the reputation, and certainly that definitely weighed heavy on my decision as well. So
you come here. What are some things that you start to get involved with? What are you working on, and how has that changed over the years?
So right now, I've been working with the training staff. We're trying to beef up the coverage of the different high school sports teams. Then we've got Allegheny College that they picked up right at the beginning of my start here. So I cover some games there, but I'm also trying to get my name out there with the older crowd too, because I don't just work with young athletes. I mean, it's anyone who wants to be active or be functional again. They lose function in their knee or their shoulder and they need some kind of work. I'm there to help them out.
So let's quickly just touch base with the athletes, and then let's go to adults and spend time there, because for those who might not know, on the athletic side, going into the schools, you may see the athletic trainers on the sidelines during sporting events, and they play an important role of keeping everybody healthy. And again, if there is an injury, trying to get them back on the field or court or whatever sport they're playing as quickly as possible.
Yeah, so I mean, sports medicine is just like any team. All the athletes work together to meet their goal and win. Like for us, we have a team. We've got athletic trainers, we've got physical therapists, and then just all my staff. Really, there's a lot of communication involved with trying to get the athletes rehab back. It's not just me. I mean, I rely on all my team to help get these kids healthy again and get them back, or all my patients really in general.
When you fast forward, now you're talking about adults, and the goal is to get them maybe back to work quickly, right, or back to exercising or enjoying life again. So talk about maybe the older population, reasons they're coming in to see you.
Yeah, so I mean, commonly I'll see people with rotator cuff tears or strains of the shoulder, even shoulder arthritis. I do shoulder replacements as well. So I'll do any kind of arthroscopic work on shoulders or knees. People can sprain their knees, tear ligaments in the knees or their meniscus that I work on, cartilage injuries of the knee as well. Those are probably the most common. So a lot of times, there could be, someone who just has an overuse injury, tendonitis in their shoulder, their elbow, or their knee, and they'll come in. They want to get back to playing golf or hiking, just being active in general, and that's where, I step in, try to guide them in the right direction. Sometimes it's just some therapy, some anti-inflammatory. Sometimes it may be surgical if, we can't get them better, without surgery.
So much has changed, and everything you just said there, from therapy that's available to the surgeries, and maybe you can talk a little bit about how much has changed, since your time there, and what does the future look like?
I think in sports medicine, a lot of the treatment really relies on non-surgical rehabilitation. A lot of times it's inflammation, sprains and things that need some rest and truly rehab. But some of these more severe injuries that require some kind of surgical intervention. Technology is improving now. We're having better anchors, better suture fixation for fixing tendons down. They're doing a lot of research into kind of the best way to get these tendons or ligaments healed. Things like biologics they're looking into, spinning people's blood down to try to get a more concentrated makeup of healing, molecules, if you will. And I think eventually in the future this is going to continue to, improve, our recovery efforts. It's still kind of in the early stages, but biologics are going to be huge, and there's always improvements in implants, since the beginning of time when they're using ivory for replacements and things like that. So.
It has to be fascinating just keeping up with all of that and kind of not knowing, but getting a glimpse of what the future is going to look like for what you do.
Yeah, no, it's really exciting. I mean, sometimes we have to be careful on, the newest and latest and greatest. We got to be careful and see, how that product is panning out, because sometimes in the past there's been history of new products that people thought were going to be like the future of the orthopedic world, and all of a sudden it fails early, and now they have all these people that they need to revise. But in the same sense, a lot of this new technology is eventually going to bring a lot of improvements in recovery, speedy recovery, better function and outcomes, and that's kind of what they've been working on research-wise for all the different implants in general.
Well, and then you have a big story last year in Aaron Rodgers and his recovery efforts, and that's just kind of incredible when you might receive an injury that 10 years ago you might say, hey, it's going to take a year, or you might not be able to play that sport again, or now you're saying, hey, you should be back next year, or yes, you can get back out on the golf course.
I think he's also, a special breed with how quickly he recovers, because some people aren't recovering that fast no matter what you do. But it is pretty incredible what we can do with some of the new techniques.
Well, and I think when you talk, going back to adults, hip injuries, knee, ankles, these are big things that people know, and the recovery side of it and the rehabilitation side is different now than what somebody may have heard about years ago. Again, because things change. Yeah,
definitely. I mean, years ago, people were, kept in the hospital for like a week or two at a time after a knee replacement or things like that. We've definitely sped up a lot of the rehabilitation protocols. I think some of it's modernization of these protocols too, as we get a feel for how far you can push, your repairs, or you have a stronger repair from better, suture material and things like that, that you're able to get them moving sooner than maybe in the past. Maybe it wasn't as strong, but we're definitely getting people up moving faster with some fractures that, we fix, or different, reparative procedures, shoulder, hip, knee, basically any joint. So it's definitely evolving over time.
Sometimes somebody will hear community hospital or rural setting and think, maybe they don't have the latest technology or as talented staff as maybe a larger city, but that's not the case with Meadville Medical Center. They really invest in the staff, the equipment, the tools that are needed. How does that make you feel knowing that there is that commitment to what you do?
Yeah, I mean, I completely agree. I mean, I feel a lot more confident knowing that I've got everything we need. They get it, whatever we ask for, we're getting, so if we need, more modern implants, we've got them. We've got all the staff to back it up, and we've got staff that are dedicated to helping get these patients better. It's, like nowadays you see a lot of this traveler market too, and, you don't really know what you're getting. Here we know we have people in the community, they're dedicated to help, with patient recovery. We have an excellent team, and I think we have all the modern, equipment we need to succeed like anywhere.
But there's some fun with the patients, and there's that level of care where they're not just a number, but there's a name attached, there's a personality, there's caring involved.
Yeah, I mean, I think it's important to connect with the patients too. They really aren't a number. I try to connect with each of them when they come in. I'm not trying to just speed them through and just sign them up for a surgery or something like that. I try to get to know the patient, get a feel for what their goals are, and then how we're going to approach their injury from there. And it's fun to get to know the patients,
Do you get stories like, oh yeah, you had my neighbor, and this is what they went through. I think this is what I'm going to have, so I'm going to have a similar recovery as my neighbor.
Oh, yeah.
No, that's not how that works. You're an individual. You're going to heal different. We're going to put you on a different path.
Yeah, definitely. I mean, everyone's different in terms of activity levels, their biology, their capacity to heal. It can even be different based on how you do your therapy. You can see differences across the board. Sometimes you can't pin it down to what's causing a difference in outcome. Is it because they went to a different physical therapist? Is it because they just don't heal as fast as someone else? But the end goal is the same: try to get them back to being functional, pain-free, and having active lifestyle, and being satisfied with what we did.
Do you have patients who maybe come up to you at the grocery store, they see you out and they say, hey, thank you, it's great to get back hiking or playing golf, or maybe you pick the paper up and you see that athlete that you had a part in helping, and now they're breaking records or doing something great in sports? Oh
yeah, absolutely. We'll run into people at the store, or we'll get a card sent to us afterwards. I had a patient's mom send a card of pictures of them getting back to sports, and with a nice, note written with it. All the time we'll see people out, and it's kind of a nice feeling to see them getting back at it. I mean, that's my goal, is, to get people back and active again and be happy and not being held back by an injury and keeping them from, happiness.
And that's, and again, from teen to later in life, your job, it sounds like, is to get them back to living life.
Yeah, exactly. So, I mean, I don't want anything holding them back, Even, a lot of times you have people that just can't sleep at night. They've got a rotator cuff tear. They can't do anything with their shoulder. They can't play golf, and they want to do that. And they're not happy if they're not out there on the golf course. So, I mean, that really is the goal. We need to get them back to doing the things they enjoy, or at least to the, highest level of function we get them back to based on what their injury is. Yeah,
and again, as you're saying, that point now compared to maybe a couple decades ago is pretty amazing.
Yeah, I mean, definitely the surgeries too have become more minimally invasive, like rotator cuff repairs. 99% I do through a scope. 20 years ago, most of them were being done open. So that helps with recovery, pain, even in knee surgery as well. I'm doing it through a scope. And it definitely helps. They used to do big open ACL reconstructions, where now I can do it all through a scope. And before they'd flay the whole knee open like it was a total knee, to completely open up to reconstruct that ligament. So it definitely is. It's come a long way.
So for those watching who might be having an issue, why should they schedule time to see you and the staff? What sets you guys apart from others?
I think we've got a very friendly team. We're going to spend time with the patient. We're going to make sure we hear their concerns and make sure they're addressed. Not everyone is just has one problem, which is, let's say they tore their ACL. There's other components of the injury. There's psychological aspects too, where now this person can't compete or they can't participate in a sport or an activity they want to do anymore. I mean, part of it too is counseling the patient, talking with them, and getting a feel for what they're going through to try to help them, cope with this until we can get them better. And I think we give them more, comprehensive care, kind of treating the whole person, and certainly they're going to have, all the most modern treatment methods that are out there.
You were pretty active in high school, you said. What do you do to relax now?
I'm less active than I used to. I've got a couple little kids, though. I got a 1-year-old and a 3-year-old, so I chase them around outside or, push them around in a little car. And when I can, I like to go hiking, fishing, whatnot, anything outdoors, really.
So, thank you.
Thank you.
Learned a lot. Greatly appreciate your time. All the best.
Thank you.
And we want to thank you for joining us as well.